Common dentist advice to prevent oral and health disease. The tooth is not only helping you for mastication of food and your look or aesthetic, but it also may take a very important role to maintain and improve your good overall general health. Know about common mistake, negligence which maximum patient usually do, and also know about common dentist advice to prevent your multiple health issues. Poor oral health can cause multiple other health problems. Take care of milk teeth. Our experience is maximum people are not taking care of milk tooth or deciduous tooth, but they take cares to the permanent tooth. A milk tooth shows the path of eruption of permanent teeth. So if the milk teeth will extract before, then at the time of permanent tooth eruption it can erupt in the wrong place. Take care of your milk tooth to prevent caries. It also helps to build up a good habit to prevent the multiple diseases in future. Oral bad habits like thumb sucking, tongue thrusting, mouth breathing, nail biting also can cause orthodontic problems, misaligned tooth. Early extraction of milk tooth can cause malocclusion, improper tooth alignment, of permanent tooth. Every 6-month visit dentist to get scaling treatment and regular checkup. Dentist advice. Good oral hygiene is one of the important key factors to stay healthy. Mainly microorganisms are going inside to body through the mouth or through nose by respiration or food, and another part is covered by the skin so microorganism can't go inside. The microorganism which is going through the mouth that struck on the mouth and slowly goes inside the body causes infection and diseases. Poor oral health is a risk factor of multiple diseases like heart disease, stroke, caries, gum problems, dementia, diabetic, digestion problem, respiratory infections, cancer and pregnancy complications, etc. Tooth sensitivity and bleeding gum. Tooth sensitivity can be an early indication of loss of tooth structure, caries, attrition, erosion, abrasion and fracture, and gum disease. Bleeding gum is a very common indication of gum disease. Tooth sensitivity and bleeding gum, it may be easily cured, but maximum patient neglecting it, and they are using different types of toothpaste or materials, influenced by different commercial advertisement or by someone, but they are not getting the proper treatment. Sometimes that toothpaste may give you temporary relief. But if you want correct treatment, get dentist advice, and with that, you can get the permanent relief and you can save your tooth. Use proper toothbrush and toothpaste. Brush your tooth gently. Brush your tooth twice daily gently and use the proper tooth brushing technique. Better to use a soft toothbrush. Use good toothpaste. If you are affected with tooth attrition, erosion and abrasion, then use ultra-soft toothbrush. Dentist advice is to change your toothbrush in every 3 to 4 months. Do not extract the tooth if restoration is possible. If you are having caries tooth, then try to get restoration of that tooth. Don't extract your tooth if tooth restoration is possible. It is commonly seen that after extraction of a tooth, side by tooth and opposite side tooth moves and shifting in that place, it can cause gum problem. Those tooth becomes weak. One more reason is for proper food mastication. You should have the tooth. If you can't masticate food properly, you will get digestion problem and malnutrition. As per patient's comfort, the natural tooth is much better than an artificial tooth. Advice regarding orthodontic problem and malocclusion. If you are having the orthodontic problem, then commonly you may get poor oral hygiene, gum problem, tooth attrition, temporomandibular joint problems and headache. You should get treatment for this. 13 to 18 year of age is very ideal for orthodontic treatment. Advice after extraction. Dentist advice. The patient should keep the cotton tightly in the extracted socket for 1 hour. Any problems after extraction, contact your dentist. After extraction up to 24 hours, patient should not take any hot item in the mouth. She can take ice cream. She should take soft food. Don't spit and suck, swallow the saliva. After 24 hours of extraction, the patient generally advised to rinse the mouth with warm salted water daily, 4 to 5 times per day for 14 days. Do not disturb the surgical area. Do not rinse vigorously or probe the area with any objects. It helps to clot formation and wound healing. Don't take tobacco and alcohol item at least for 14 days after extraction. You should replace your missing tooth. After extraction of the tooth, you should replace your tooth. Because, after extraction of the tooth, if you won't replace the missing tooth for a long time, then side by tooth and opposite side tooth moves in that place, and that it causes changes in occlusion and gum problem. Those tooth becomes weak. If you will replace the missing tooth, then you can somewhat protect from the movement of a nearby tooth. For proper food mastication, you should have a tooth. If you won't masticate food properly, you will get digestion problem and malnutrition. Other reason for tooth replacement is to stop tooth attrition, to stop temporomandibular joint problem, lockjaw and aesthetic. Visit www.medihelp365.com, find doctor, hospital, medical service provider information, read useful article and lots more. Subscribe our YouTube channel, Medical Help 365 Days, to like this video.